Dr. Michael Weaver is a native of Kansas City and has contributed to the St. Luke's Hospital in Kansas City in a variety of ways, including serving as a longtime director of emergency services and currently still the medical director for clinical forensic care. During the last 7 years, Dr. Weaver has served as vice president for clinical diversity for St. Luke's 11 hospital health system. In this role, he has sought out many trainings, leadership opportunities at the state and national level. I smiled when we were talking about the opportunity for this type of training within the medical training process. It sounds like Dr. Weaver has found it after his medical training process in the ongoing training that he's sought out. So with his clinical and leadership experience in the field, we're really pleased to have him here today. He's going to guide a panel discussion about both current and future interventions. And what we'll see is brief presentations on 3 examples of Missouri models, and then Dr. Weaver will facilitate some questions for the panel and then open it up to all of you to ask questions. So with that, I turn it over to Dr. Weaver.
Thank you, Ms. Miller. Sure.
Double mics.
Thank you. So I really want to thank the Healthcare Foundation and MOAC for putting this on. I feel like I'm part of the choir like you all are, and you know, we need to get our battery recharged every once in a while, and it's really great to have a networking opportunity like this. And it's a lot of buzzing going on during lunch, and like I said, I think that's just a wonderful opportunity. So as Michelle said this afternoon, continuing with the excellent panel we had this morning, we have 3 participants who are going to share with you their innovation in terms of being able to create ways to decrease healthcare disparities in their area. So they're going to share their promising practices and outcomes and incorporate the research that they've learned and share those successes with us. As Michelle said, we'll start with each of them giving a small presentation. And then after that, I'll facilitate questions for the panelists, and then we'll have questions from the audience. We'll kick off this afternoon by introducing Ms. Cynthia Dean. Her full bio, as well as the bios for all the participants, are in your handout materials. She's Executive Director of the Bootheel Regional Consortium, which is located in Sikeston, Missouri. And she brings over 30 years of experience in working with community and public-based healthcare programs. And what she's going to talk about this afternoon is the Fatherhood First program. Ms. Dean?
Okay, everyone should have a copy of my handouts on your table. If not, we'll make sure that you get one. And I have a short, limited amount of time here. Okay. First of all, how many of you all have been to the Bootheel? I always like to ask that because sometimes I'm startled. Good, we have quite a few people here that have been, because I'm startled a lot of people haven't been to the Bootheel, and some people, we found out recent in our area, a lot of people really don't leave outside of their county. So coming to St. Louis or Kansas City or Columbia is a big deal for many of our residents. Also, MBRC, the background, basically our mission is to strengthen and promote families. And we established the Fatherhood First program in 1998, so it's been around a long time. And one of the reasons that we established the program is because of the fragmentation of many of the services targeting men, particularly African-American men in the Bootheel, and the many disparities and things that are associated with health, but not only unemployment and some of those other risk factors. This also gives you an area of the Bootheel. We cover 5 counties. There's a 6th county in the Bootheel that we're not covering, that is Stoddard County, but these are the counties: Duncan, Mississippi, Scott, New Madrid, Pima, Scott, and Stoddard County, well, Mississippi, Duncan, New Madrid, Scott counties. And these are the counties that have the largest rural concentration of African Americans in the state other than St. Louis and Kansas City. The Fatherhood First program primarily targets African American males who are 16 and over, who are unemployed. Many of them have been incarcerated. Many of them have low skill levels and have completed high school, have not completed high school, and some have dropped out of school as early as junior high school. We received a grant from MFH in 2010 to promote the Health Literacy Demonstration Project. And it was adapted from Hal Sullivan's program out of the St. Louis Father Support Center to focus on direct consultation with the staff and the factors that are associated with male health literacy. Okay. One of the reasons that we decided to put this program together was because we observed with many of the other programs that we have with our Fatherhood First program is that many of the clients had difficulty communicating with the doctors, but also this was a major factor. Many of the guys did not go to the doctor because they felt that, number one, they didn't have the money, they didn't understand the language that was coming from the doctors. And so you'll find out more about those statistics as we move forward within the presentation. And many of, as you know, these statistics here are very similar to some of the things that we discussed this morning that Ryan pointed out in the manual that you have associated with African Americans, and that many African American men have the highest occurrence of fatalities due to health care and other chronic diseases as well. And many of them lack the health literacy skills as well. One of the goals of the programs was basically to improve health literacy and serve in the 5-county Bootheel region of Missouri. Many of our males, as a result, they knew how to schedule and prepare for the doctor's visits. Many other participating males communicated effectively with their physician and other healthcare providers as well. There were 3-week sessions using interactive presentations, role models, interviews. We have all those things taped as well. Curriculum topics including sexual health, cholesterol, substance abuse, blood pressure, diabetes, and many other chronic illnesses. And then one of the main draws for the program is that many of these men got to have a free health screening from our federally qualified health center in the Bootheel. And that was one of the main drawing tools. Otherwise, many of these men could not have had the screening that was associated with the program. It was a free service as part of the participation of the program. We provide transportation. Not only do we provide transportation to the healthcare services, but we provide transportation to the program as well. We actually pick these men up, bring them to class, and take them home. And we provided a stipend from $150 to $150 to $200. Many of the males with a direct link to qualified medical professionals, they became more proactive in their health care with increased knowledge and improved communication skills. Who did we serve? We served a total of 277 participants who received the services. 76% of the men attended at least half of all the sessions that were offered. 93% of the men were African American. 60% ranged from age 20 to 39 years. And 76% were single, and 90% was unemployed. These are some startling statistics, but they are real. What were our results? Increased understanding of their health and health-related issues, significant increases in participants' understanding of their family and their medical histories, and the conditions that they were at risk for based on their lifestyle and their family history. And for many of these men, this was the first time they had an opportunity to really sit down and discuss their health and really go back and ask questions about their family health, their children's health, their partner's health. Over 76% reported that they had attended the doctor's appointment through the program. They improved the dialogue with the physicians because during the class they were taught what questions to ask, how to engage the conversation with the physician. And many of the physicians' data indicated that 64% of the participants asked at least 3 questions related to their health and that the care being provided during their appointments. So we did some intensive follow-up, and I just want to say the data-driven process of this program has really made the impact, and it really drove the outcomes as well. Every part of this program was evaluated from the A to the Z, and I think that's one of the reasons it was also very successful. What were our results? Increased access to important healthcare-related information services. More than half of the participants received treatments at 54% from their physicians, and more than half, 51%, required follow-up visits. Participants overwhelmingly received their doctor's appointments as positive. Nearly all of them agreed that they were satisfied with their doctor's visits and they understood their doctor's recommendations. And then they asked the questions as well, and then they left comfortable asking questions. And then they also, one of the other things that's not on here, is that we found out during the class that many of them would go home, discuss the questions with their spouse or whoever, and they would bring questions back from them back to the class and discuss them again. So this really sparked interaction, communication, and really a communication dialogue from the family and the program participant as well. But, okay. back here. Okay. Okay. Participants' increased knowledge had begun to translate into positive health behaviors. Nearly 96% of the men agreed that they had followed through with their doctor's advice in at least one area since their visit, and the majority of 72% reported they were definitely or probably planning to alter their behavior or decisions regarding their health since involvement in the program. We had a focus group in November of last year, and the program ended actually in December, this particular part of the program. And these were some of the results from the focus groups. Participants described the program using positive descriptors such as excellent, informative, great for men, and someone to listen to me, which is always a great factor here. Participants indicated that attending the doctor resulted in diagnosis of health ailments, including health cholesterol, high blood pressure, and lactose intolerance. Many of them reported improved communication with their doctors as a result of having specific questions written down prior to the visit and an activity they learned during the health literacy classes. So being part of the class really sparked them to write the questions down and actually go in confident when they went to the doctor for their visit. They then were committed to improve their health, including decreasing alcohol consumption and smoking, and increased exercise and healthy eating as well as a result of the classes. The program provided an opportunity for participants to receive free health exams, as I pointed out earlier. Most of the men reported they had not been seen by the doctor for an extended period of time due to lack of health insurance and the inability to pay for medical care. We also know that many of these men, the only time that they saw a doctor if they were incarcerated is when they were incarcerated and when they ended up in the ER. Those basically were the doctor visits. And some of the participants said they had never ever went to the dentist. We saw that was one of the other high factors, risk factors, when we did the risk assessments, earlier risk assessments with them. Recommendations including provided additional bonding opportunities for participants and their children, similar to the annual Take a Kid fishing activity, and continued skill development, resource linkages, as well as child support and legal assistance. Some of the implications were that sizable number of the participants reported that they did not have medical homes at the onset of the program and utilized hospital emergency rooms for healthcare needs. Many of them did not seek medical care due to the lack of insurance, money to pay for services, and overall distrust of the healthcare system. Bridging the gap between African American men and the healthcare system through this type of intervention is an effective way to increase their health literacy, promote early health screening, and diagnosis for preventable health conditions that reduce the cost for the provider and the patients and encourage positive health behaviors. And these are mainly some of my favorite parts, just to give you a visual aspect. We market this program and have marketed, and it actually sells itself because many community partners love this program, and they have for over the years. This is one of the billboards that we still have up in one of the interstates. These are actually participants of the class. We've had many graduations over the years. This program has served thousands and thousands of men in the Bootheel for many years, since 1998. This right here is, we actually have another program, a federal infant mortality program that we've had also for 17 years that mirrors this project. And we have case management, we have nurses that come in, and the guys are right there in the building, and we have the in-services that are focused around back to sleep, SIDS, and other areas that are also part of the curriculum. And this is a mechanical doll that the guy is holding for the back to sleep program that we have. This is one of our classes as well. Many of these guys, and we have a video. I encourage you to go to our website. We have a video on there that states their future, presence of the futures matters, and that's a video about our Fatherhood First program. And it really tells the story of how many of our classroom participants over the years and how this program has impacted their life. And many of these men have never had anyone to show any type of appreciation for them. When they have the graduation services, you see many of them bring their children, their pastors, their girlfriends, their grandmothers. This is a big deal for them. And it's very emotional because for the first time, many of these men have been incarcerated for many years, and this is a door that opens for them to get back into society and work with their families and their children. This is Mr. Howard. He's a special guy because Mr. Howard, you may see a thin African-American male, but he was in the class. He went to the Federally Qualified Health Center to get his blood pressure taken. And His blood pressure was so high, all the numbers at the bottom and the top were 3 digits, very high numbers. And the doctors panicked and they called and said, we can't let him come back. We've got to get him in now because he could have a stroke. They still couldn't figure out why he hadn't already had one because his blood pressure was so high. But he contributes that screening to him being alive because the doctor said it was only a matter of time. He basically said that he smokes a lot. Of course, that's one of the contributing factors. And he had alcohol consumption, but in moderation. But he said he had 1 meal a day. He ate in the afternoon, but he didn't eat breakfast and he didn't eat lunch. And so we were going back trying to figure out through his assessment why he was just basically having those major health barriers. But as a result of this class, Mr. Howard started eating breakfast. You know, he's sort of like a pioneer now. He goes about and talks to groups. He talks to the churches and many men in different settings. That this program, the difference that it made in his life. Oh, I think I pushed the wrong button there. I pushed the sleep button, didn't I? There you go, I'm sorry. Okay, there we go. We have an annual fishing clinic, and I know that may be something new to many of you all, but we've had this event for like 16 years as well. And it is co-sponsored by the Department of Conservation and Walmart and many other vendors as well. We had 600 people there last year, and they come from Kentucky, Tennessee, Illinois, Arkansas, and Missouri. And this has become an annual thing, and also the National Guard provide the tents from Iraq as cooling tents, and this is a big event. And so this is another opportunity for a family bonding activity that we've had for many years as well sponsored. And these, again, are many of the class participants in front of our office. And many of these guys, as I said, this is an opportunity for them to really see that someone really cares about them. And our program has been recognized by the National Fatherhood Institute in Washington as one of the leading programs in the country for many years. And again, I would like to acknowledge the Missouri Foundation of Health, Mr. Adams, along with some of the other evaluation teams that really played a critical role in this program. And these are some of our other programs that we have. Thank you.
So that's really wonderful innovation. You're to be congratulated. It's, we know black males are at risk in a number of areas, and your organization has clearly developed trust, which we talked about this morning as being an important factor, and it's been sustained long enough in the community that you have buy-in. So it's wonderful. Thank you.